While the Health Department is welcoming the Competition Commission's Health Market Inquiry Report and recommendations, the recommendations focus on interventions to increase the competitiveness of the private healthcare sector. These include easing the access to and affordability of private healthcare. The recommendations will guide legislation around several issues plaguing the private healthcare sector that have now found clarity and definition in the report. Dr. Anban, the Deputy Director General from the Health Department, joins us now for this conversation. Dr. Pillay, thanks a lot for joining us this afternoon. Let's speak a little bit about exactly what this inquiry found. Before we even go to recommendations, what was found?
Good afternoon to you and the viewers. Yes, Faith, the inquiry found a number of things. They investigated the costs in the private health sector, and they focused predominantly on the high-cost areas, which are private hospitals and specialist costs. And what they found is basically on the side of hospitals that there are three hospital groups that are highly concentrated, and these hospital groups dominate the market. The consequence of which is that there are very high tariffs in the hospital sector. They also found that there are inappropriate relationships between specialists and hospitals in terms of the way their commercial relationships are, which has a consequence for the way patients access care and leads to overutilization in many cases. In the case of practitioners, they found that practitioners offer high-cost services. However, the consumer has no idea about the quality of those services and the outcomes linked to those services. You usually go to a specialist in order for you to get better when you're ill, but you have no idea whether actually after paying all those high fees, whether you actually will get better. So I think it's very important that the outcomes of the health services are clearly spelled out, and the inquiry highlighted that as one of the areas that are missing. And then thirdly, they raised the issues relating to medical schemes, where medical scheme trustees have very inappropriate relationships with the administrators. There are a number of benefit options within schemes, making it very difficult for consumers to determine what is an appropriate package. And most of the benefits are largely hospice-centric, and they've encouraged us to actually move towards a primary care package. So those are, broadly speaking, the key recommendations in the findings of the report.
Dr. Anban, to be quite frank with you, it just sounds like the private healthcare system is run by a cartel.
Well, I think that's one of the terms that was used by the Competition Commission, where there is collusive practices, very close relationships between the various entities, where you would think that they would be acting in the best interests of the medical scheme members. However, they were acting in their own best financial interest, and that's the real problem.
Yeah, I mean, on the other side of it, then it almost bodes the question around this repelling of NHI. So we've seen a lot of criticism come out, especially even in the media that we've spoken about, of a different entity saying that, no, look, the NHI will not necessarily work in the South African context right now, and having a list of all of those reasons. But it appears as though if those are the findings, that actually private healthcare is run in a cartel manner, and that people are paying exorbitant fees for less quality service and healthcare, that means that maybe that's why that the NHI is being opposed so much, because it's going to be a competition to already existing mechanisms.
I think you're very correct in your diagnosis. The problem is that many of the players in the private health sector have financial interests linked to the current market structure, and the NHI disrupts that structure in a significant way. So clearly they are going to oppose the NHI. But I think for consumers, the benefit is that we will certainly be implementing a system through the NHI which would have a regulatory mechanism to deal with the issues of prices, to deal with the issue of the quality of services. The worst thing you want is to go to a practitioner and assume that he's going to make you well, and you actually don't know whether you're going to come out better than you were before when you actually went in. So I think many of those issues we're going to be dealing with through the NHI and through legislation that we would introduce.
Yeah. Dr. Ahmed, very quickly, before we wrap, then how does the consumer protect themselves? I mean, how do they know that they're being duped?
I think that it's very difficult for the consumer to get information in the current environment. You would note that this commission gave themselves 2 years to do this work. It took them 5 years because the private sector just didn't cooperate with the information. So what we want to do through legislation is actually make most of this information public. How much is the real cost of the service? What are the outcomes when you go to practitioners? What are the best plans to purchase in terms of medical schemes, etc.? Because the consumer needs to be empowered so that he or she can make the right decisions about which plan they want, etc.
Dr. Anban, we're going to leave our conversation there for this afternoon. But thanks a lot for joining us and shedding some light in terms of those recommendations, as you heard about our private healthcare. Dr. Anban Pillay there giving us the latest. Still to